Alrighty, shall we start, Paul?
Sure.
Yeah. Hello, everyone, and welcome to Paul Movsessian's workshop on Moxibustion and dosing. Just a little bit of housekeeping before we start. Just to let you know, we are recording this, and the recording is currently on. We've started the recording a little bit early, and everyone is muted, just so that just to reduce distraction and background movement of the camera and tracking and that kind of thing. In terms of questions, if you have any questions, just pop them in the chat box and I'll be tracking those and flagging them with Paul. So the first part of this presentation, it's a 90-minute presentation with Paul delivering his talk for the first 60 minutes, and then we have a 30-minute question and answer session at the end. So please do pop your questions in the chat box. If you have any issues, pop them in the chat box. As I said, I'll be tracking them. We will make the recording available in the next few days afterwards. We have a YouTube channel now. The Australian Shiatsu College has a YouTube channel, so we'll be popping the recording up there. I know we've got some international visitors who are wanting to watch this, and the timing is a little bit difficult for them, so we'll be making it available for everyone. I think that's about it. Please, as I said, remain muted. It just makes everything a little bit easier in terms of the tracking of the video and background noise for people to be able to hear what Paul's saying. So thank you for spending your Sunday morning with us, and I'll hand over to Paul.
The share screen too.
Oh, yes. Sorry. So we have share screen activated at the moment because Paul's got some images he wants to share. Please don't touch the share screen button. Just ignore that button. So it is active. So I ask you to avoid flicking that on for yourself. Thank you.
All right. Thank you, Lawrence. Thank you so much. And thanks to the college for setting all this up and recording it. I really appreciate everyone making the effort to log into this. It's amazing. We had, I think, like 150 people register, so it's only can take 100. So the videoing will be great for the people who miss out. And I guess it's first in, best dressed, as they say. Before I start, I just want to say how it just makes my heart really happy to see so many faces and people from all over the world. It's really great to see you, and thank you for the people who are getting up at really odd hours. Okay, so let's begin then. The idea with dosage and Moxa is first let's talk about the word dosage, because I think it's important to qualify what we mean by dosage. Originally, dosage meant that it comes from how they used to add spice to wine for flavoring. That's not how most people know it today. Most people know it today because of the biomedical term that's used when you're administering some kind of drug therapy. So the idea of dosage is clearly involving the application or the regulation of what you want to do to change the situation or the circumstances. Now, when we learn, particularly in traditional East Asian medicine, we don't really learn a lot about dosage. We usually have a very standard treatment principle. For example, I would say, when I had studied in college, the idea was you have the person on the table and they're going to be left there for 22 minutes apparently, or 23 minutes, because that's how much time it's going to take for the qi to circulate. But you could leave them there for 40 minutes if you have to read the newspaper and have a cup of coffee. But other than that, there was no real clear definition about how long do you really leave a person on the table. There are practitioners I've heard that have forgotten the patient on the table, and sometimes even gone home, turned the lights off, and they were so busy. So that understanding of the fact that when a person comes to see us, we have to take into account what is the treatment dose for them. Well, let's come and look at that slowly. So traditional East Asian medicine uses this term to describe the specific amount of treatment that will suit the patient. And that means that we have to take into account the patient's needs, the patient's constitution, the nature of the illness. We have to take into account the, the history of the patient, and whether the patient is sensitive, whether the problem is a chronic and stubborn, difficult condition, if they've gone to see lots of people, or if they have generally been receiving a lot of treatment, whether it's traditional East Asian medical treatment or a variety of other treatments, whether they're getting another treatment that day or that week. And also often people will ask, how many times do you want to see me? So they may want to know whether I need to see them every day, once a week, once every 2 weeks. All of this is part of what we would classify as dosage when we're thinking of it from the traditional East Asian medical model. It's really interesting, just before we move on about dosage, to consider a few things. For example, of course, if we're using herbs in Chinese herbs or Campo herbs, we're going to be aware of the idea of dosage, but we might still only be aware of it from the perspective of the ratio of what we're putting in. And what I want to discuss is something very interesting. When we're talking about drug therapy, it's clear we have the idea of overdosing. If a person overdoses, we know that they could die. Using a strong biomedical drug can lead to death or near death. We often don't think about it so seriously in what we do, because we think what we're doing is natural, and when we think of herbs as well as being natural, we often don't think of overdosing. There's a situation also where often the dose that's recommended for a lot of things, whether it be for the herb that we're giving, or whether it's Chinese herb, naturopathic herbs, etc., the ideas of that dose, where they came from a time when dosing itself was different because of the nature of the people's constitution and health, as well as the substance they were using. For example, when we use a plant today to treat a person, and we look at a traditional dose for that plant, and you'll see that, right? It's on every bottle of anything you get, whether it's tissue salt, or a vitamin, mineral, etc. All of these doses that are written there, no one questions, like, how did they come up with this safe dose that is apparently good? What we discover is that those dosages primarily come from a very let's say more ancient time, and the potency of those herbs were much more powerful in those times. The soil was different. The pollution wasn't there. You weren't spraying them with the kind of Roundup and all other sorts of pesticides. You had seasons that were probably more in tune and in line with the way nature was working, and people's health was quite different. People's ability to withstand a lot more was there, because life was a bit rougher. We didn't have the luxuries that we have today, central heating and air conditioning, the house being really sort of comfortable, and etc. All of these things that today we take for granted, running hot water, your toilets inside, etc. We have to imagine what it would have been like for people. There wasn't as much as jobs that related sitting down at a desk, for example. People were out there doing things. They were laboring. And so people were more hardy, their constitution was stronger, and therefore the illnesses that they were probably experiencing were quite different as well. And so the doses that we see today, in my experience, are way, way too low. The potency of the things that people are taking, they look like they could be dangerous to take them at higher dose, but in my experience, I found that you really have to increase, much more, for example, of whatever you're taking and how much of it you're taking and how frequently you're taking in order to actually get the effects. And that's because of the nature of what's happened today. So our society and the new diseases that appear, and our way of dealing with disease has changed. So thinking about this, let's move into the traditional East Asian medical ideas. So first, we've qualified what the word dose means. Let's think about now the word moxa. So the first thing we need to do is to dispel the notion that moxa is stick moxa. So stick moxa or bokyu was fantastic as far as in the times of when it became popular post Mao period. So Maoist model of TCM was creating the barefoot doctor's version of acupuncture, sending people out to treat millions of people who were needing of medical attention. You weren't going to have a lot of time to teach these people the refined skills that are required in the more elevated levels of traditional East Asian medicine. So medicine changed quite dramatically in the way Maoist or communist version of TCM was sold to the West, and also how it was introduced into China. And of course, you were dealing with people in the fields, a lot of laborers. The different areas of China, of course, are varied as far as the north, south, east, west, and central. And we find in the classics that in those different areas, depending where one was, different tools were used because of the nature of the climate and the nature of the food. So, for example, where you would have people that have a lot of sort of cold and damp and wet condition, maybe in the rice fields, etc., warming for a long time with stick moxa would be great. I mean, we could do that today with a heat lamp, for example. We don't have to stand there with a stick and breathing in the smoke and just holding it there and for endless hours, or having a moxa assistant. So when we talk about moxa, we're talking not so much about stick moxa, although we can think of that as part of this. We're talking about direct moxa that can come in the form of rice grain, and the variety of rice grain and how the rice grain is applied. We're talking about cone moxa, needlehead moxa, etc., etc. So this is the kind of moxa we're talking about, rather than stick moxa. The principles, of course, in moxa also go much broader to using variations of all of these. So you've got, for example, platform moxa, where you can either have a platform because of the base itself being like ibuki moxa, or kamaya mini, which is a moxa within a little tube, or you could place something down on there like a piece of ginger or aconite or garlic or something that will salt, for example, etc. So you've got this kind of platforms. Then you've got electric moxa as well. You've got a lot of electric moxa techniques, smokeless moxa. We've got moxa that relates to fumigation, steaming, etc., etc. So there's so many ways that we can apply the moxa itself. So what I'm going to try to do is, because there's such a broad range of applications, I'm going to try to synthesize this into the principle of how we decide a dose, and then taking whatever technique we're going to do, applying the principle to that technique. Now, this could also be applied to any other therapy as well within traditional East Asian medicine. So it would be like cupping, bloodletting, needling, and so forth. And I'm a big believer that these traditions that we practice, particularly moxa, it may not be a popular may not be a popular point of view, let's say, but for me, I don't feel it's the sole prerogative of just one small group of people that have decided it belongs to their profession. I really feel we've come to a time now where professions can, you know, cross over. Dr. Manaka was really an example of that. As a Western medical doctor, he worked with traditional East Asian medicine. He was a surgeon, and he also understood Campo and herbal medicine. He was able to work with, you know, polarity devices, Moxa techniques, meridian therapy and pulse taking. He was working with color therapy, Qigong therapy, scalp acupuncture, electroacupuncture. He worked with Sotai, which was the body work, and Seitei from Dr. Hashimoto. He was not someone that was so exclusive, and he was unusual. We would have to say, for a Japanese practitioner, he was unusual, but he was very open to allowing things to enhance your treatment, take the best of what you could get, mix it with what you've got, and give it back as long as there was some clinical result. I'm a clinician, so I'm not really a theorist. I mean, theory, and although I have been involved in theory and research, and I've done my research and all my training, for me, clinic is what I really love, and teaching how to have efficacy in the clinic. This is what I really love to do. So let's look at the clinical application of dosage. First, the duration of the treatment. You know, how long is the treatment going to last? So let's say you've got a person, and we're working with Moxa. If you're only going to do, like, there's some Moxa traditions that only work with 1 point, you know, and that'll be their constitutional treatment, and the person is really sensitive. So are you going to have the person come in and give them this 1 point Moxa, and it's going to last 5-10 minutes, and then send them out to the receptionist? Or, you know, if we're only going to work that way, we have to also think about how else will we make the visit therapeutically beneficial for the person. Sometimes I have people that drive, you know, 2-3 hours, or I have people who have come from interstate. You know, so what we can think of in that case is that we also have to take into consideration explaining things to patients, letting them understand what we're doing, why we're doing it, and how it works. I really love patients understanding how Moxa works and why I'm doing the dose I'm doing on them. I explain to them what their constitution is, and it helps them when they go to other practitioners as well. So the other things we can recommend are, you know, home things, home recommendations, home therapy. We can teach people how to do the Moxa at home, and then they come in for the core treatment that they can't do, and then they can do things at home. Then again, explain to them how frequently we would do this. So how frequently do they come in to see us? How long are they there when they come to see us? And then we have to have a prognosis. Now, in our model of medicine, we haven't really been trained in prognosis. We don't understand what, you know, a person comes in and usually asks, how long is this going to take? And we're like, well, let's see, you know, let's give a treatment and let me know how you are next week. That's not a satisfactory answer. I mean, imagine if you went to a Western medical doctor, a specialist, and you asked them that, and they said, well, let's see, you know, like, I mean, that would be really, you'd be worried, right? So we have to have a level of assessment, and Dr. Manaka created a prognostic model, which we'll come to in a minute. And this allows us to tell the patient whether they're going to need to see us for a long term or short term. Now, this is something, again, because as I said, we need to explain to patients, if we're going to see them long term, we have to make it clear why we see them long term. You know, how I explain it to patients is that I express to them the fact that they've come in with something that they've had for 20 years, and there's no way that I'm going to be able to magically make this go away. We're not doing magic per se. So this is a medical science. It's based in deep tradition that has been able to validate over a long time these methods. So the first thing to understand is that we're going to treat your constitution. So every treatment has to have a constitutional component. By strengthening their constitution or their root, we explain to them that what we do now will hold up to the point that your body can hold it. It may be for 1 hour, it may be for half an hour, it may be for a day, it may be for 5 days or 3 days, but while it's holding, the person is going to get well. The body is going to be healing. The self-healing mechanism is going to be triggered. And in doing so, each week, it's going to hold longer and heal more. And then we will reach a point where they will be able to hold the treatment and they can come in for maintenance. They can come in just because they feel well and they just want to come in and stay well. That's what that's the goal of our clinic, to have healthy people coming to see us, right? That means we are elevating ourselves into a superior level of a practitioner because we're preventing disease from occurring. Right. So it's not about just waiting until the problem is there and then having a great branch or symptom control. That's good, and we want to alleviate their symptoms, but we want them to know that without strengthening their ability to self-repair and heal, that's going to be useless. So for that, we will be able, through the prognostic model, to clearly explain to them why they need to come for so long. Usually I give a block, a break, a block, a break, a block, a break. You know, that may take a whole year to do three courses with me. And then the second year they're going to, you know, not need as much because they're feeling better. But some people, they'll come in and, you know, one course is good for them. They'll do quite fine. How many points do we use? Dosage is going to be asking in Moxa, how many points will I use on the person? There are some traditions in Moxibustion lineages where they use only a few points, maybe 2, 3, maybe maximum 4 points, but they do a lot of Moxa on that point. There are others that will use lots of points and only do a little Moxa on each of them. There are some that will do Moxa on the front only, and then, you know, something on the back later, you know, another time, etc., the next day. In Japan, it's a little different than in the West, where you've got patients that are quite willing to come every day. They're willing or capable, you know, to live. They live within sort of your town. They can walk to see you. You know, sometimes for us, especially if we live in the city, you know, people are hard pressed to get there one day a week. So we have to take that into account. How we're going to, you know, when they come, how frequently they're going to come, how many points are used. If we're in dosage for other particular things, where, for example, with needle therapy, you would want to know how long you want to retain the needles. In Moxa, we would look at how many rounds of Moxa we would do per point. So that would be how we would think of it from a Moxibustion tradition. Whereas if we were thinking of microbleeding, we would be looking at how many points, but also how much blood we would squeeze from each point, or how many vascular spiders we might choose, etc., etc. In cupping, you might say how many cups, how long we leave them on, and how strong would the suction be, for example. If you were using tools like needles, you'd be wondering what gauge of needle you'd be using, how thick is it, what metal is it, etc., etc. Now, when we're looking at Moxibustion, this idea of a root treatment and a branch treatment or a symptom control, you need to decide your ratio. How much root treatment compared to branch treatment? In other words, Dr. Manaka's principle was that if you do a really good root treatment, then you probably have to do less for your symptom control. If your root treatment is not so strong, then you probably end up having to do a lot more when you're dealing with all the complaints that they've come in for. So ratio of root treatment to branch treatment is very important. In Moxa, there isn't technically the idea of supplementing and draining as there is in needle therapy and many other aspects of traditional East Asian medicine. But we could say that the tighter the cone and the hotter it burns, the more dispersive the Moxa. So we want to know how much dispersion do we want to do. Shiro Denmai, who was a Moxibustion that became a meridian therapist, in his practice, what he tends to do is he'll do his needle work first. He'll do his meridian therapy, and then after he finishes tonifying or draining with the needle, he'll go and he'll find points that belong to the pattern and work with Moxa. So he'll apply, for example, he'll look for indurations or hard spots. That's his favorite, and he'll apply Moxa to those. That's quite strong, and this is not uncommon for an induration or something hard. But when there's a vacuous, deficient area, then you definitely don't want to be doing that kind of Moxa. So how do we control it when we do it with a cone? Well, with a cone, we would allow it to burn either a third or half and remove it before it gets hot. So in a deficient vacuous situation, we might say, look, the moment you feel a sensation, let me know, and we remove it, or let me know when it feels a comfortable warmth and I remove it. If I want to use cone Moxa, for example, Ikeda Sensei will like to use a lot of really tight, as does Edward. Well, at least Edward was when I knew Edward. I don't know how he's practicing these days, but when I knew him, he was working. He'd have people making little cones, and the cones were quite firm, really, really tight. And they would often put a lot on the upper back, finding hard areas and dispersing. So you'd let them get really hot, and as they get hot, you just keep taking them off one at a time as they reach that almost burning sensation. Of course, you never let a cone get down to the skin, so you want to get it off before it reaches the skin. With rice grain, we've got options of extinguishing it at 50%, 80%. We can deny it oxygen. We can, again, roll it really tight for an induration, or we can let it, let's say we want to get a zing because we've had an insect bite, a bee sting or a wasp sting or something. You want that to get really, really hot. So you'll let that burn all the way, really, really hot. If you've got inflammation, you want it to get hot, but not hot in a long sensation of hot. You want a quick zing. So you make it what they call a thread, literally the thickness of a thread. And you encircle your inflamed area and you let them zing, 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 zing. So that would be treating an inflammatory area, and you would raise the body's natural inflammatory reaction. Of course, in this presentation, we don't have time to go deeply into the mechanism of Moxa and how it works and why it does the amazing things it does. We'll see if we have a chance, but I don't know if we'll have a chance. But I'm talking about if we have to have an understanding of how Moxa works to apply these techniques as well, right? So you can use bamboo to also change the effect of the Moxa. One of my teachers in Japan used to put a heat shield and then Moxa on top of the heat shield, and the Moxa, of course, would burn really hot, but the heat shield would give it some protection. And then he would use these bamboos that had a slot in them, so you could actually see how you do the technique. Another one of my teachers uses shunko cream, and she only lets it burn quite minimally. It's quite strong, it burns, and then it's removed and repeated. Many Moxas on this, and treating skin conditions, inflammatory conditions, and so forth in this way. So recognizing how we are dispersing or tonifying with the Moxa. In general, Moxa was considered a regulatory dose, so we would apply it and it would regulate the body because it would reorganize how our blood was flowing, our immune system or Wei Qi, how our movement of yin and yang in the body was. If we've got counterflow Qi, heat rising, bringing that down, rooting it below, warming where it was cool, removing where it was hot. So there are these ideas of Moxa just being regulatory, and a person feels quite profoundly integrated when they have established that regulation to their system. Their nervous system feels organized. Their head feels clear, etc. The other aspect of Moxa is that it can do things in the reverse of how we've often been taught or thought of with Moxa. For example, let's say we have a person that has a fever. We often won't think of using Moxa for a fever, but on Governor Vessel 14, the meeting point of all the yang, if we do Moxa here during a fever, we can actually get the yang to release the heat. So we use fire to reduce fire. Again, in TCM thinking, that would be sort of contraindicated, partially because a lot of ideas that have come through in TCM have come from herbal traditions, which don't necessarily translate to the acupuncture tradition. Moxibustion, to the Moxibustion tradition and acupuncture tradition. And so we have to recognize that Moxa has their own lineage, their own texts, their own way of diagnosing, their own way of treating. So partly with Moxa, touch is very, very important. So if we've been denied the possibility of training how to touch the body properly, then we won't know how to actually find these points. So looking at our symptom control, we would have to decide, which Moxa technique we would use. Warm needle, for example, reinforces the needle effect. Dr. Manaka liked to do that on the back shoe points. He'd find somewhere across the striation of the muscles, tight, stiff area, and put a needle and put Moxa on top of that. So we could put Moxa on a needle at a joint, for example, knee joint, or we could do Moxa around the knee joint itself as direct rice grain Moxa. So there's many, many ways to think of. Okay, let's look at some factors to consider for dosage. When the person comes in, what's their constitution like? Are they very strong? Are they very weak? Are they a yin or are they a yang constitution? This is really important. Yang strong constitutions rarely come to see us. We can treat them, but often, I have to say, most of the people I've seen, their wife dragged them in. That's like, they weren't going to come. One of them, he was so interested in what his wife was doing and the changes that were happening, he just decided to come and have a little sticky beak himself. But and he was like he was a chef. Well, he is a chef, and he's from the UK, but he's living here. Is really, his constitution is really rugged, right? But as we started to treat him, I found all these sort of weak deficiencies in there, and then he was a bit surprised at this. So we have to determine now. Clinically, we probably are going to see a lot more deficient people coming in to see us. And the strong, healthy people often wait until they've reached rock bottom. So when they come, they've actually become more sensitive than the deficient patient. So if a person comes from a history that they were really strong, and you need to know this in your initial consultation, if they've had a really good, strong constitution that allowed them now to be sick, that is a much more sensitive patient than just a deficient patient. The nature of the disease. Is it an acute disease? Is it a chronic disease? Is it moving fast? Is it moving slow? There's a principle in traditional East Asian medicine that we always treat the new diseases over the old diseases. We always treat the diseases that are acute over the chronic. So we may need to determine order of treatment. When they're giving you their symptoms, are the symptoms in line with their constitution, or have their symptoms moved so far away from what their original constitution is like? The further away the symptoms are from what their constitution is, the prognosis is poorer for these people. So they'll need longer treatment, clearly. We need to take into consideration their living and working environment. let's say I've got someone who works as a butcher and they're constantly going in and out of the cooler, the freezer. You know, I have to know that with what I'm doing, and they have to become aware of the effect that this has and why now their body has this cold lodged in there. And for them, maybe they're definitely going to need home therapy if they want to succeed in their treatment results. Or if someone's home environment is really damp or toxic, etc., etc. We touch the luster of their skin. We look at how their skin feels. That tells us a lot about the dosage of our Moxa. The rougher and the drier the skin, the more we can do with our Moxa. And of course, there are some areas, for example, like there's a point, urinate, that's on the sole of the foot, often used for food poisoning. And it's a location that's often we find has a callus there or thickening of the skin. It's the same with bladder 67 at the little toe. If you've ever tried to do Moxa to turn a fetus, that traditionally came not from stick Moxa, although stick Moxa may do the job, but traditionally bladder 67 was used by putting one round of rice grain on each toe, seeing which one didn't feel the heat. That insensitive one is the one we use. And so we go to the insensitive one and we keep doing Moxa until they feel it and until the fetus turns. That's how traditionally bladder 67 was used with Moxa, rather than just sort of sitting there with a Moxa stick. And with urinate, the same. We pick the insensitive one and we keep going till they feel it. So this is part of dosage. We're not going to get the result simply by just doing a prescribed number of 1 or 2 or 3 that's written in a book, like a cookbook recipe. We actually have to measure this as we're going. Fertility, for example, there's a point that is measured from the distance of the mouth and the mouth from the nose, and making this triangle from the navel, there's a point called chujo. And in this point, one of the traditions talks about using Moxa at each of those points. So you do the 2 points at either side of the navel. So imagine that my tip of my nose is the navel and the 2 ends of my lip are the points. So those 2 points would get the age of the patient. So if she's come in and she's 45, that's 45 here and 45 here. That's 90 Moxa. Is that a big dose? Do you have time to do anything else? You have to ascertain. Am I going to be sitting there? Do I have a Moxa assistant and a second room so I can go to my other room? I mean, that's how traditionally you should do it. Also, you have to be quick, right? If you're slow, like if you're like, one Moxa, you know, let me roll the other one, and 2 Moxa, you know, now I've got to get to the other side. You know, you have to really develop a skill to be able to get a rhythm and a quickness to your Moxa technique. Or you have to find another way to try to produce that same kind of effect with another tool that's not going to require you to do 45 rounds twice. So all of these things are relevant, but we may also say that if you don't do 45 on each point, maybe the treatment is not going to work so well. So if that person requires that, maybe I'm going to need to set a certain time aside to be able to do this with the patient. The age and the gender is very important. The older the person is, it's not the weaker they are, but usually the more blood stasis. They can actually take a stronger Moxa treatment and love it. So we don't treat the elderly as gingerly kind of really weak people because, oh, you know, they're old. Quite the contrary. Most elderly people have a lot of chi. They just have blood stagnation, which doesn't allow this chi to move very well. So they do really well with Moxa and they love it. I mean, it's amazing. Elderly people and really young kids make us look good. We just sort of do the Moxa and, you know, move the blood and chi, and they start to really respond really well to that. Their occupation may be relevant. and also their experience with traditional East Asian medicine. As I said, if they've had a lot of treatment, then they're probably going to be a lot more sensitive. Sometimes we think that the more treatment a person has had, the more treatment they can tolerate and have, and the more we should do. But it's quite the opposite. The more treatment they've had, the less we do, because the more treatment means that their system is much more sensitive. So the more treatment, the more sensitive the person is, not the more treatment that they've had, the more I should be able to do. Their medical history, of course, is going to be very important, and that's going to take into account a lot of aspects as well of how we work. Let's say, for example, they are diabetic. Moxa is not going to be so good on the limbs because they have the possibility of diabetic neuropathy. The skin is thinner. The chance of burning them because they don't feel anything is also stronger. And if they get that burn, they'll have an infection. People with compromised immune systems, also greater risk of burning, greater risk of creating infection. So we really need to take medical history into account. If we use pulses, we should observe whether the pulse matches the disease. So let's say, they have let's say they have a hot condition, but their pulse is slow and sinking. That's not matching. Something's not right there. So that's also a big clue that the prognosis is poorer, and what we have to do in dosage-wise may have to be a little more careful. Also determining whether the problem is at the chi level or at the blood level. Moxa is excellent for things that are at a blood level. Hence, the more chronic, stubborn, difficult the things are, the more blood stasis exists, then the better is the result with Moxa. Moxa is going to be not only the best treatment in this particular case, but also we can probably get away, if we look at all the other things I've been talking about, with a lot more Moxa treatment for that person. Determining whether they're a normal sensitive person or a hypersensitive person or a difficult stubborn case will also tell us what to do. So even with key level sensitive patients, Moxa is also very good, but we have to alter how we're doing the Moxa. For example, we may want to do 50% rice grain. We may want to do cone Moxa that only burns a third with no heat, etc., etc. So we can change again what we're doing according to the sensitivity of the patient. Now we need to look at the idea of what a sensitive patient is and what a stubborn, difficult case is. So let's look at sensitive patients. Who is a sensitive patient, which is, this would be like a person who's sensitive but who's not hypersensitive. They're just what we would call normal sensitive. So let's see, children. Most children are going to be normal sensitive. As I said, they make us look really good. We don't do many points on them. The fewer the points, the better the result. Usually, one of the main points is governor vessel 12, which is going to boost their whole immune system. Like that's almost like a root treatment for them. So governor vessel 12 is their constitutional treatment. And then you could do 1 or 2 points depending. For example, let's say they're not thriving, their constitution is not doing so well. So depending on their age, we might do 1 Moxa on bladder 18 and 1 Moxa on bladder 20, and we determine the side of treatment because of gender. So for example, with males, we would do bladder 18 on the right, with females, bladder 18 on the left, and then bladder 20 on the opposite of that. And so we do governor vessel 12, bladder 18, bladder 20, and that's it. That's their treatment with Moxa. Of course, with children, you've got other approaches as well. As I said, if you're using Shonishin or some kind of non-insertive tools, it's very, you will apply them. But if not, then there's time to talk with the parent, explain to them, you know, aspects of how home therapy could help the situation with the child, depending why they're there. But also with children, you have to recognize that they might not always cooperate. So you may need a lot of time just to get them to do that one moxa, because for whatever reason. With children, it's really important not to let them see the moxa or see the fire, the incense stick or something like that. Often it's good to hide it. So when I light my incense stick, I'll you know, make a sort of a sound. We might think it's really good for them to know what's going on, but I assure you it's not. So if you say to them, look, don't worry, this is not going to burn you, all they're going to hear is blah blah blah, burn you, right? So your word, your selection of your words are really important. Asking parents for permission, making sure that they understand what you're about to do, maybe getting the parent to help. Often when I say to them I'm doing something on their back, you know, I get them to count with me. Can you count? You know, you've got to play games. You've got to do things with kids. Moxa for children is not the same as moxa for adults, although sometimes I wonder. But anyhow, so psychoemotive problems, right? People that come in with psychoemotive problems, normally sensitive. These people, their energy field is really out there. Noger's auricular medicine has a way of measuring the vas pulse using a filter to the ear. And you can see these people, you bring the filter and it's out there and the pulse is jumping, right? Their energy field is out there. These are people who are, you know, can feel everything. They feel the suffering of the world, you know. They walk down the shopping aisle and they feel, you know, they feel the sort of detergents and the, you know, all the chemicals. They sort of walk out saying, I have a headache, I feel disoriented, etc. So these people start to sort of move into the hypersensitive realm, right? So, but people who have psycho-emotional problems, normally are going to be normally sensitive. People with insomnia, they're going to be sensitive patients. Sleep disturbs blood, and sleep disturbance is a blood disorder. Jet lag, people who travel for work. I have a lot of people who are pilots and flight attendants, and you know, people changing time zones, etc. Shift workers, nurses, for example. You'll see doctors, nurses, and healthcare professionals. We are sensitive. We who are on this call right now, we are all normally sensitive people, you know, because of what we do, our work. It makes us more sensitive. Doctors, for example, you know, they look like really tough people, but they, you know, often they have been exhausted from the years of doing those interns in their hospitals, you know, 36, 48 hours without sleep, then having to go in to do a surgery, etc., and they almost never recover. So, you know, I remember when I was in 4th year in acupuncture school, and I was looking at the first years, they were out in the, just out the door, I could see them, and they were just so happy, you know, so full of energy. And I was sitting in there in 4th year, like, you know, I was like, we are beaten down. We've been beaten down to the point. I was looking at them thinking, just, you know, you don't know what's, you don't know what's waiting for you, right? You can all understand what I mean. You know, by 4th year, you're exhausted. You know, the amount of exams, what you have to learn, the Western medical things, all the names, Chinese names, channels, points, you know, syndromes, blah, blah, blah. It's like your brain is like saturated. So, you know, we don't ever recover. We go out and we go straight into clinic. And then we just keep doing it, you know, and then we go to workshops. Anyone who's using their mind in their work more than physical labor is a normally sensitive person. So people who have desk jobs, a patient that is fatigued, just generally fatigued, they're going to be a little more sensitive, as would a person that has a generally deficient constitution. So you're going to do less on all these people. You're not going to do more. You're going to pick your moxa carefully with these people. You're going to pick a few points. You're going to do only a little bit. You're going to let them build up and build up and build up their strength. And then as they build up their strength and you can see that they're getting stronger, you can do more. People who are meditators, yoga practitioners and psychics, etc., generally healthy people, right? They're going to be normally sensitive because their chi is flowing really well. So you treat these people with less dose. You don't think of these people as, coming on, full strong because, you are a healthy individual, so I can do more on you. Quite the contrary. Who's a hypersensitive patient? Now, when we get to hypersensitive, our moxa has to be really minimized. When I use moxa with hypersensitive patients, I may only burn like 20% of the moxa on a rice grain. And as I said, if I use a cone moxa, I make my cone a little smaller and I only burn a third of the moxa and remove it. So infants and toddlers, these are hypersensitive. You don't need a lot to push them overboard. If you push an infant or a toddler overboard, you'll produce in them fever, you'll produce in them sweating, clammy, diarrhea. They'll often have diarrhea. So you've done too much on them. People that are neurotic, we're talking about all kinds of neuroses that are starting to affect people's spirit, the Shen, So neuroses, people that have a lot of sort of neurotic behavior will be super sensitive. So you do very little with them again. Chronic fatigue syndrome. Chronic fatigue syndrome does not need a lot of super energy to be put in them. Quite the contrary, you need to assist them by building up their energies. They often have also fibromyalgia. It's not uncommon to see fibromyalgia with chronic fatigue. So there's soft tissue damage. Moxa is fantastic for that. Environmental illness. People with environmental illness will be super sensitive. Sometimes when they come in, they may not even want moxa because the smell of the moxa sends them over the edge. So you may have to use a different technique of smokeless moxa, electric moxa, etc., etc. I have so many tools at my disposal that I can meet anyone's needs. So if they cannot, then I have an electric moxa device, or I can use a heat lamp, and etc., etc. There's lots of ways that we can get around these things. With a hypersensitive patient, you may not even be able to use moxa itself. You may be able to get a moxa spray or a moxa oil, and you drop a moxa drop on the point or spray, and then put the heat lamp on it and warm it up. Or you can you can do other techniques. For example, one of the techniques we use is where it'll sound funny, but it really feels lovely, where we put the moxa, a big bag of semi-pure Wakakusa moxa wrapped in a towel, and then we use an iron, and we use the iron to press the moxa. And so no smoke, but all the effect of the moxa is going through. Or you can put a hot water bottle on it, and it will also assist that. So there's a lot. There's in the moxa tradition, obviously there's so many ways that we can meet the needs of all these people and still do moxa even though they are sensitive. For example, maybe where we work in our office, all the practitioners don't like the smell of moxa because we're in a multidisciplinary clinic. So we can also modify our moxa because of that. Etc. Or maybe we're alone, but the office we work in, it'll go through the air conditioning, and then people from other professions come and complain to us and ask us what we're smoking in here. So that old joke, it never gets old, does it? The people with chronic headaches, they're super sensitive. Be very cautious with people with chronic headaches. I find it one of the more difficult things to treat myself because there's not a simple headache. It can localize in many places. It's very easy to make it worse. It definitely requires long-term treatment. The causes of headaches are so varied. So you have to work little by little to work, to ascertain what's the best treatment for chronic headaches. Cardiac disease also, you have to be careful because we're moving blood with moxa. So our dosage has to be designed to be cautious, not to create big surges in that the heart can't cope with. So be careful. Allergies are also hypersensitive patients. they are very, very sensitive because of the parasympathetic dominant reaction that they're having. Acute inflammation is another problem. You have to be cautious because in order all the inflammatory conditions, whether it's all the itises, as well as now all the autoimmune diseases, last stages of cancer, we also have to be very careful with when we treat, super sensitive. And any patients that are receiving heaps and heaps of treatment, they are very, very sensitive patients. So if they've come in and they tell you that on Monday they see they go to yoga, and then on Tuesday they do Pilates, and then Wednesday they have a massage, Thursday they see their kinesiologist, Friday they do their chiropractic, Saturday they come for acupuncture, Sunday they go and have shiatsu. That's a very sensitive patient, right? They're doing a lot. And you may think I'm joking, but I had a guy, and that was not only that. I'm even downplaying it. There were times that he'd see 2 or 3 people within a day, and every day he was seeing someone. And I was begging him to stop. I said, just pick one. Just pick one. I said, it doesn't have to be me. I said, just pick one, because he had this very bad skin condition, and everyone was giving him conflicting ideas. So everywhere he went, they were contradicting the other person, and whatever I did, someone did something different. And by the end, that person was getting so many mixed messages, he just wasn't able to recover. Who are the less sensitive patients? Less sensitive are people that have chronic illness, elderly, as I said, not sensitive elderly, people that don't have inflammatory conditions. These are not sensitive patients. Patients that have had many surgeries, lots of scars, are on lots of medication, that's typically then less sensitive. Stubborn, difficult conditions like psoriasis, less sensitive. Blood stasis problems, liver disease. People that are extreme athletes or sports, these kind of people, they do the Ironman and the triathlon and decathlon, and those people they don't respond. You don't have to take it so easy on these people. Manual laborers, again, people that work with their body out in the sun, out in the field, out with the, laboring, building, etc., etc. These people are less sensitive. Okay, so quickly I want to just talk about blood stasis. So blood stasis, what we can see is some of the progression of blood stasis. It can occur because of obstruction to the microcirculation, and this is where Moxa is going to be really good, because what you've got is within the capillary bed. So direct Moxa at the surface of the skin is going to move and change this. We'll have a look what kind of symptoms show up, but obstruction to microcirculation could occur from people that are in a lot of contact sports. They get, hit a lot, bashed, and black and blues and so forth. Football, netball, etc., etc. All these kind of contact sports. So trauma and bruising would be involved. Menstrual problems, history of menstrual problems creates blood stasis, including habitual miscarriage. People that have had to have blood transfusions. This can happen because, of course, with the scenario of surgery. People that have had to deal with a lot of febrile diseases, people who travel in Southeast Asia and so forth, they come back with these febrile conditions. They end up with a lot of blood stasis in their body, which affects their liver. Sometimes people are born already with an inherited predisposition to blood stasis. People with fair skin, for example, in the Ireland and Scotland and England and all sort of Scandinavia, all these sort of fair-skinned people. I remember listening to this guy many years ago who was saying that of all the places in the world, England should never have come to Australia, because this is like the worst place for their skin, right? That because you come here and what you find, dark-skinned people. So the you know, so you can see, for example, going out and laying in the beach. I remember the days when you could get sprayed with this coconut oil that they used to have. You know, it was so delicious, you wanted to drink it. And just laying for hours and hours in the sun, right? And then wondering why we have skin cancer, why we have all these freckles and you know, moles and etc. All these things were coming. So sunburning is a big one that will cause blood stasis. Liver disease in general, whether it's fatty liver, you know, hepatitis, etc., etc. All of these things that connect with the liver and liver congestion. And this tends to produce what we call counterflow chi. So often with blood stasis, we want to have a feel under the liver. And if we see like tension or congestion under the subcostals, then we go over down to the left lower quadrant and we will feel there where the hepatic and portal vein go down to the rectal vein. And so you might end up finding that a person with liver disease ends up having this cross pattern, and the weakness below means that the heat rises and the cold descends. So they've got all the heat above, all the itises, sinusitis, gingivitis, etc., rhinitis, and down below they've got a cold belly, cold buttocks, cold knees, cold feet. So all of that counterflow chi is blood stasis, and these people are going to work really well with Moxa. These people are going to do really well with a lot of Moxa. You're going to be able to disperse above the heat and root the warmth below, dispel the cold from below. So these kind of disease, these kind of conditions do really well, and your Moxa technique, your dosage can be quite good. You can do quite a lot. As well as the scenario with the cross pattern, you've got the situation as well where constipation can back up the rectal vein, back up into the liver. So a history of chronic constipation. I'm talking serious constipation. I've seen some people that have had, you know, constipation where they go 10 days before they go to the toilet. That produces really bad liver and blood stasis. Some of the symptoms might be also bacterial infections, that, you know, big history of bacterial infections. If people bruise very easily, spontaneous bleeding, or blood coagulation that's led to stroke, people with a history of congestive heart failure, heart attack, hemiplegia. As we said, the drier the skin, the more varicosity. If you've got this cross syndrome, you've often got left sciatic pain. But people that live in a lot of pain in general will have blood stasis. People that deal with a lot of head, ear, eye, nose, throat problems have a lot of blood stasis. And you can see it. You can see kind of the cheeks, the way the cheeks may show the little vascular spiders or bloodshot eyes, etc., etc. As we said, history of gynecological and digestive complaints and so forth. I just want to show you something on the share page. I'm just going to share something quickly. Okay, can everyone see that all right? Can someone give me a thumbs up? Okay, so here's the cross syndrome pattern. So you've got this right subcostal, left lower quadrant. It's very rare to see it the other way in blood stasis. This is the pattern you're looking for. On the back here, in between the interscapular region, you'll often find like freckles and dots and so forth that that come up. You've got also here around the cheek, just on the cheek level with the nose, you've got what's called the Hirata zone. This is the liver zone. So this will show up as well. So these are common areas that we find blood stasis. This down here is a treatment that Dr. Manaka developed using a magnetic cooker. When it's kind of an alternative to Moxa to move the blood. So if I had someone with deep blood stagnation that I couldn't use Moxa with, I might use this electromagnetic cooker to clear the congestion. Here with the right palm, it clears the right subcostal, and then down at the left sole of the foot will clear the lower left quadrant here. So this is something of what blood stasis may look like. Okay, and then just to finish off, Dr. Manaka created a protocol of creating prognosis, and he based this blood stasis in 3 degrees: stage 1, stage 2, stage 3. Stage 1 is often when people have only a few little freckles, maybe a few little pimples, you know, not very much of the symptoms we've been describing, a little, you know, maybe a little bit of, as I said, a little bit of pigmentation, etc., etc., not much going on. So everyone has a little blood, you know, has a little blood station. This is very easy to treat. But when you start to see all their pigmentation going darker, they start to get little venules, they start to get little spider veins that aren't going away, they start to get a little more varicosities, the moles start to become more brownish or reddish, the skin starts to become drier and rougher, and even calluses on the feet. So there's a location on the feet. There are 3 main areas for liver, spleen, and kidneys that show up. If they have a lot of irregularity in their base temperature for their body, all of these people are going to show a slower progression to treatment. They're going to need longer, and they need more Moxa. Number 1 needs less Moxa. Number 2 needs more Moxa. And especially if they have developed now more problems around pain that's not clearing up, digestive complaints. So what they've got is they haven't got really diseases, but they've moved into disturbances within their systems. So you can't call insomnia a disease, but you know, if you're suffering insomnia, it's not pleasant, but it's not a disease per se. So eventually you move to, of course, these have grades and grades and grades, right? So eventually, if you don't look after this in stage 2, it becomes stage 3. Sometimes it becomes irreversible. It can go so deep. Everything is so bad, so much varicosity, so many moles. Now you understand, if you see a cancer patient or an elderly patient, you'll see these patterns on them. They've got lots of varicosities, lots of dry skin. They've got lots of freckles, lots of skin tags, moles, etc. Their face can become dark, bloodshot eyes. In men particularly, you see baldness because of the blood stopping to supply the scalp and the heat that is generated there. Dandruff can occur also before this. Not to say that if you just have dandruff and none of the other symptoms that you're at stage 3, right? Just to be clear. Organic diseases now start to develop. You know, ulcers and tumors and degenerative problems and so forth. Very, very slow to heal. And this is a real stubborn condition. This is going to take a long time, and the person has to be willing to sort of be with you to work through this if they're going to get well. At some point, it may be that it's just palliative care that you're on. And I've had to be at that stage with some patients, and it's an honor to be with them during that time, to help them during that time to be more comfortable. So just a few things about dosing to finish off. This is probably now, I want you to take this into account as far as how you're going to use your Moxa. First of all, we may never have had a concept of overdosing. We may have always felt that the more we do, the better the person is going to be, because it's inherent within us to want to make the person better. So we're naturally going to want to do more. We're always going to say, maybe if I just do a little bit of this, I might do a little bit of that. And then sometimes the patient says, oh, you didn't do anything for the neck today? You know, oh, okay, I'll just, you know, even though I'm running late, I'll just do a little something for you, you know. And so signs, what are signs of overdosing? Sleepiness after treatment, not a good sign. We may have thought that this is a great sign because, oh, the power of what I've done, right? The person's so relaxed, they feel so sleepy. Not a good response. I don't want my patient to be so sleepy after my treatment that they can't get off the table. I want them relaxed but alert. If they feel heavy, overdose. Sweating, if all of a sudden they've started to get clammy, then you've overdosed them. If they feel worse, it's not a healing crisis. I've overdosed them. If the pulse has changed to a poorer quality, if the hara has changed to a poorer quality, if they've now started to get cold, I've overdosed them. My Moxa stimulates blood circulation. They should start feeling warm. They should start feeling warmth through the body. So cold is not a good sign. If the luster of the skin hasn't improved, If they start to get flushing, not a good sign, I've overdosed them. If there's symptoms that they came in with are aggravated, I've overdosed them. It's not a healing crisis. If they start getting anxious and they feel, if they start feeling like their adrenals are starting to hypersecrete and they're starting to feel anxious after the treatment, I've overdosed them. And in the worst case scenario, if they've gone unconscious, I've overdosed them. I mean, it sounds silly to have to say it, right? But I've seen people that, you know, have done treatments that have caused that. I've seen people. I had a student who was being treated in the student clinic at the college when I was teaching, and one of the practitioners insisted on continually to stimulate the needle, and she was saying, it's hurting, it's hurting. He was saying, this is good, it's good, this is what you want to feel, until she fainted. And every time she fainted, he didn't think of anything. He just waited till she revived, and that was basically, as far as he was concerned, that was dirt cheap, you know, like, and as I said, there is a lot of people out there that think there's nothing absolutely wrong if you have this unconscious reaction to the strong needling. Reasons for overdosing: overemphasizing root treatment rather than symptom control rather than root treatment. Sometimes when we keep repeating the same treatment every week, that can create overdosing. Patients have to be seen moment to moment each week how they are. Sometimes if I use the same point over and over in the treatment because I didn't get the result I want, but I keep doing it, I can overdose the person. Using too many points to do Moxa on, I can overdose them. Too strong, the Moxa is too strong as far as heat. Misjudging the patient's constitution. Sometimes a person comes in and they look like they're really strong, but they're actually quite weak. So I have to assess that and don't just take it for granted because someone looks big and strong and muscularly that they have a good constitution. Sometimes these are the people that can go down very easily. Misjudging the nature of the disease. Sometimes it's because the person has come in and told us one thing and the disease is something else, right? They haven't decided to tell us this because they didn't think it's important. They didn't think we can treat it. So sometimes we don't have all the information. And we might use the incorrect tool. We might use the wrong Moxa technique. And lastly, one of the main reasons for overdosing is if we allow the patient to dictate treatment. One of my teachers, I remember Yanagishita Sensei, the way he put it was that chocolate cake is good, but too much chocolate cake is not good. And this is basically it, right? The person may feel like they're really enjoying the Moxa you're doing, like say Ontaki, warm bamboo Moxa, and they're loving it, or like elephant warmer, and they're like, oh, and you say, I'm going to take this off, and they go, oh, I could stay here all day. No, don't go, right? Sometimes I come in and I remove the heat lamp, and they say, no, don't, I will kill you, you know, like they're loving the heat lamp so much they could just lay there, they just say, go away. I open the door. I've had patients say, go away. Like, imagine if I listened to my patients and said, oh, you know, I want them to enjoy my treatment. Okay, you stay here for another 20 minutes, I'll be back in a minute, you know. No, you can't. All right, so I'm going to stop here. But let's just finish with one positive thing. How do we correct overdosing? That's a very important thing, right? Let's say we've overdosed them. The simplest way in Moxibustion to correct an overdosing is, depending on how severe the overdosing is, the most simplest is to make a Chinetsky cone very light, fluffy, and soft. I like to sit them up. I don't like them to be laying down when I do this with their face in a face hole. I'm going to do GV14. So I like them sitting up, and I'll do it there. And usually only one round is enough. Take it off either as soon as they feel warm or at a third. That usually fixes everything. It's so remarkable. People just are amazed at how quickly their attention comes into focus. If the person can't sit up, then turn them over and do CV6. If the person is at that point where they somehow are sweating and they're feeling anxious and they're unable to, they feel heavy and you can't get them off the table, that's a very severe overdosing, which can happen with a person that has environmental illness or is just a super hypersensitive patient. Then you want to do salt moxa. So salt moxa at the navel. So we usually place something down. I put a tissue there, fill up the hole, fill up the navel with moxa, make a cone, and you burn that cone till it's hot. So you burn that cone till it's hot. That one has to burn till they feel it. Then remove it and lift the tissue with the salt, because the salt will burn them, because the salt will continue to conduct the heat. If they have an outie, if they don't have a navel that you can put a little hole like that, then when you put your tissue, I have a toilet roll, if you can get toilet paper anymore. No, it's just joking. So if you, you get a toilet roll, you just cut off about maybe 2 inches, something like that. You place that on the outie and you fill that with the salt, and then you put the cone on top of that, right? And then you lift the whole thing off, all right? Never pour the salt on just into the navel. Stomach 36 can be used. It's not wrong to use stomach 36 with cone moxa. It's better with cone than direct, but rice grain. But and lastly, there are occasions where I might use governor vessel 20 with direct rice grain. And that you have to let it burn all the way down. It will singe the hair if they've got hair. You just tell them that the hair will grow better, grow back stronger, and it'll be fine. It does too, it really does. So if they're boiled, it's easier, right? Okay, so I'm going to stop there. I've tried to cram a lot in a short amount of time. There's so much to say, right? So much to say about this. It's one of the most amazing subjects. So I think we're going to move to question time now. Okay, so I'm going to just go down this little chat to see what the questions were, I think, or I don't know if Lawrence was going to try to...
Yeah, I've texted you all the questions, Paul, so they're all in sequence.
Oh, okay, in the chat, in the chat box, right?
No, on your phone.
Oh, my phone, okay.
Yeah.
All right, let me see that. Okay, oh wow, great. Okay, in case of bee stings, where around the sting gets infected or cellulosis, would you rice grain the point of the sting or around the area of the sting? So with bee stings, you do directly on the site of the sting. So directly on the site of the sting, exactly where whatever it is, whether it's a bite, an ant bite, a mosquito bite, a bee sting, a wasp sting, right exactly where it bit you. You may need to do, I usually do about 7. It feels really nice to let it burn all the way. Make it tight so it'll burn hot, but not so big that it'll burn your skin. You want to make it small enough so that it'll burn and finish quicker, because the bigger the base, the more chance of burning the skin. So try not to burn the skin. You want the heat to release. It will create an antihistamine reaction there. We can even do this with needle sticks as well, if we've ever stuck ourselves with a needle. Okay. Any points that are definitely to be avoided in moxa? Well, generally we try not to do moxa over any major blood vessel, right on top of the blood vessel. But, in saying that, there's always exceptions to the rules. For example, if we've done bloodletting, one way of helping a deficient patient after bloodletting is to do a cone moxa on the site of the bloodletting. So a vascular spider, we could finish with a cone moxa, just finishing with warm moxa there, and that will allow them not to be so drained from the bloodletting from the bloodletting itself or the shiraku. But generally, not really. I mean, look, we even use the eyes, right? We just close the eyelids and we can put cone moxa over the eyes, or we can use the special moxa walnut glasses as well. There's nowhere really that, I mean, it's not so much where, but it's, you know, what point, whether that point is appropriate to be moxed. That's more important really than, but there's no real contraindications per se with moxa. More what we've been describing, such as all the overdosing, that's really what you want to be careful. Do your moxa protocols vary by gender, season, ORI clock, etc.? Yes, I do. I find that what I do with moxa varies. We live in the Blue Mountains, so yesterday was, I think, and the day before we got down to, I think, around, I don't know if it was like 5 or 6 degrees Celsius. So we're still in autumn, right? So the colder it gets, the more my moxa takes over in the clinic, and the changes of techniques I do. If I'm doing ORI clock and supplementation points, again, I like to finish sometimes with patients as a constitutional treatment. I may use the supplementation point or the drainage point for that 2-hour time slot, depending if they're an excess or a deficient patient. And I'll usually do either rice grain or cone moxa with that. Sometimes I may like to use platform moxa, ibuki moxa, because I like the patient, I want the patient to feel, you know, a whole bunch of points simultaneously, the synergy of the warmth of all of them. So I might put, for example, on the belly or the back, you know, 6 or 8 ibuki moxas, and they're all burning very, very slowly together. And that may be because of the particular season, et cetera, et cetera. So yes, there are a lot of variations that you make. Can fire needle replace the 90 rate? No, fire needle does not replace those 90 moxas for fertility. The reason being is that fire needle is used for stiff, sore pain in the muscles. It's not used as a technique to improve the fertility. Adding to protocols varying by gender, season, do you see variations for Asians, Caucasians, constitution? Well, that's a very interesting question. If you know, if we see variations because of different nationalities and their constitutions, it's interesting. I couldn't really say for sure, but what I have found is that certain nationalities experience sensations differently. Like, for example, in Japan, if I have a Japanese patient and I palpate a point, I have to often do less palpation for them to say it's sore than a Caucasian person or European person. Often with them you press, and I can tell it's really not good, and they'll say, maybe if you press a little harder, and it's like, well, I'm not trying to elicit pain, this is just to check for diagnostic pain. So I would say there's some truth to that different nationalities and so forth may exhibit different abilities of sensation that may determine whether your technique varies because of that. What type of moxa would you use with kids? With kids, generally, I will use ibuki platform moxa if the kid is a little older, or the younger they are, I do rice grain. The thing you don't want with kids is you don't want to have them move and burn themselves. If you burn a child, you'll never see them again. That's it. As far as they're concerned, you're a monster. So, you know, basically you have to be really careful. And sometimes it's not even the moxa that burns them, your incense stick. If you've got a little kid and they're moving around like that, and I'm sort of, the mother's holding them, usually it's the mother, and I'm like bobbing and weaving like Muhammad Ali, you know, trying to get to the moxa, and it's like, okay, I got it, you know. And you have to be really super, super careful, because the incense stick can sometimes touch them and burn them, and it's not the moxa that burns them. So with kids, you have to be really on your toes. It's a speciality, moxa, with kids. I mean, I've been doing it for a long time, so I feel very confident, but I would say be very careful get some skill with children before you start doing that. I would recommend maybe try to get friends' children's and give them some free treatments, or get family, or if you've got your own kids, pin them down, use them. They can't disown you until later. I work in a multimodal clinic with little in the way of exhaust fans. What's the quickest way, the least amount of smoke to warm the kidneys for lower back pain, potentially with a kidney yang deficiency or cold invading the bladder channel? So I would say if you're in a multidisciplinary clinic that does it with no exhaust fans and you don't want to use it, you've got two options. You can use smokeless Moxa called Ondan. So with the back, you can do warm needling. You can put this basket that sits on the needle head, and the charcoal Moxa sits in the basket. That's a beautiful way, and you won't create any smoke that's going to upset anyone or trigger any fire alarms. Other than that, I would recommend needling with a heat lamp, with a Farad lamp or a TDP lamp. It has to be a TDP lamp. It cannot be an infrared lamp. So TDP lamp, TDP, and needling. That would be what I would recommend for that. Read points to avoid, like yin tonifying points. Can you expand on how to best utilize these? I'm not sure I understand the question. Like yin tonifying points, can you expand? Well, but basically in Moxa, there isn't so much this idea of the tonifying yin or yang points in that sense. That's a very difficult question. I'm not sure. Maybe the person who asked this could just expand on it a little bit, because I may go off in a tangent that they don't really mean. So if you can expand on that a bit, I'll find it at the end of this list. Any points for Raynaud's disease, poor peripheral circulation, ulcers of the hands and feet? So yes, there are techniques where you can do the Moxa at the Jing points. So definitely you can do Moxa at the Jing points, but also you want to warm the core. You want to get the core energy sending that out. So there are specific points. I'm not going to use this talk to go into sort of specific point formulas and point strategies. That would be a very different kind of talk and would take us in a different direction. But what I would say with something with Raynaud's or poor peripheral circulation is that you must be careful to not burn them. They're going to be much more sensitive. You may find that you can also work with heat and pressing devices like a Tiger warmer or Thermi warmer, and use a tissue or a little Japanese cloth between the skin and them, and you can use methods like that. But also the core, you really need to warm them at the core to get everything going out to the extremities. Could you please give an example of points for heat in the upper body and cold in the lower body? Well, typically for counterflow chi, what you want to do is, if you, bladder 43 is really good at the back to help bring things down, and then kidney 1 down at the feet. So you can do that. But often what I'll do is bladder 43 at the back and CV6 at the front. That's a very good way of helping bring the counterflow chi. Do you find Tiger warmers effective? Oh, sorry, we've gone. Could you please give an example? Use of GV20 on children, is that also rice grain and burnt all the way? Usually I don't use GV20 on children. That's very unusual. I wouldn't typically use it on children. Yeah, so I usually wouldn't use GV20. GV12, 1, 2, not GV20. And with that, we use rice grain, yes. How would you treat a hypersensitive patient with blood stagnation? Well, we would take into account all the things we were talking about. So, for example, you would start off slow and you would tend to build them up. Try to build them up slowly. Let them understand that you can't sort of hit them really hard, full on, really. You have to sort of take it carefully and slowly. Is Kyoto-shin more effective for moving blood stagnation than needling when used in peripheral points? Yes, Kyoto-shin is much more effective, that's right. Would autoimmune conditions be regarded as hypersensitive immune patterns or just allergies and histamine reaction? Now, autoimmune diseases would be considered more hypersensitive. Do you find tiger warmer effective? Love it. Yes, really find it very effective. Has a lot of versatility in how it can be used. And for children also, it's a nice way to introduce Moxa. They can see the tiger warmer. I do it on myself. I do it on their mother or their father. And then I ask them if I can just, show it on them. And I try somewhere like on the back of their hand or something. And then once they see that it's safe, they get comfortable. Yin tonifying points in terms of contraindication, or just adjusting how we use spleen 6 to stimulate without drawing. These ideas of spleen 6 and stuff, I'm not sure if these points, the way these points are described in TCM are as relevant in the Japanese model and the Moxa tradition. They don't tend to see these things. For example, a spleen 6 is a contraindicated in pregnancy, but in Japanese Moxibustion techniques, we use spleen 6 all through pregnancy from the 5th month on to continually create easy labor at the end. So I don't think you can apply a lot of ideas with TCM and needling in that way with what we do in the Moxa tradition. Lumbar hernia patient improving, but day of treatment has trouble sleeping. Reports feeling something shifting from lumbar to soles. Is that overdosing? That's a good question. It doesn't sound like overdosing to me, the lumbar hernia patient. It doesn't sound like overdosing. No, I wouldn't call that overdosing. Okay. Can I please explain why Kyotoshin is more effective than needling for Oketsu? Because basically when you use Kyotoshin, because Moxa is going to be, if you just use needling alone, it said in the classics, it says that needles are really good for key level problems. Moxa is really good for blood level problems. Oketsu is blood stasis. So Moxa is going to be more effective. If you use a needle in Moxa, then you're reinforcing the needle with the heat of the Moxa. So both the Moxa is descending onto the skin as well as heating the needle and penetrating into the area. So it's a much more powerful effect than just needling alone. All right. That was a good volley of questions there. All right. I don't know if that's it. I don't see any more questions.
I think there's one more down the bottom, Paul. Can you use Moxa for children who find it difficult to get to sleep?
Yes. Can you use Moxa for children who find it difficult to get to sleep? Yes, you can. Moxa for kids is really good. But in the Japanese tradition, there is a technique called shonishin, or children's needle therapy, where we use non-insertive tools with children finding it difficult to get to sleep. It depends on why they're finding it difficult to get to sleep. If they're what we call a kanmushisho, or like a cranky child syndrome, that's typically a liver constitution pattern often, and that might be where you need to also bring stuff out of the head. So sort of working with tapping around the occipital area and GV14, etc., etc. With sleep, often there are some points with a child. There is a point that is it's called shitsumen. It's for sleep. It's on the sole of the foot. So imagine if my hand is the foot, and these are the toe. This is the big toe and the little toe, and this is the back of the heel. So you look at the child's middle finger, and you sort of take an estimate of that finger, and you would put it to the base of the heel like this, and where your tip of your finger. So you make your finger like that. So the heel is here, and this is on the sole, and where your finger ends in the middle of their sole, this point on the foot, right? On the foot, not on the hand. I'm just using my hand to show you, right? on the sole of the foot, that point in the heel, the center of the heel there, you do Moxa there, and that can help with sleep. Bladder 17 is also very important for sleep because it's a blood-related disorder, so it helps regulate the bladder 17. Someone's asking about scars. Scars are very interesting. So with scars, depending which tool you're going to work with the scars. So if you're doing like rice grain, direct rice grain, often I find I finish my treatment with that. So what I'll do is after I've done all my scar treatment, which usually has used some other method, usually from the polarity medicine, I will then palpate along the scar again and find what's left. So usually my first part of my treatment clears the scar pressure pain, whether it's on the scar or to the side of the scar. Then what I do is I go back and I find what's left, and whatever's left, I just do repeated rice grain moxa onto that. And like every 3 rounds, I press again, and it keeps decreasing until it's gone. Usually that's pretty much what I do for scars. Otherwise, you can use a tiger warmer or an elephant warmer, and you can stroke along that. I don't find that as effective to get rid of all the pressure pain that's left. So sometimes I might do that if the scar needs to just to generate a little more blood flow to it because of the color of the scar and the age of the scar and so forth. But in general, I use rice grain on the spot that's tender. So you use your Moxa marking pencil, you put a mark, and you keep going, and it usually clears. Can we do Moxa at night for sleep difficulties? Yes, definitely. Or Moxa with yang nature, will it disturb the sleep at night? No, Moxa can be done at night. It's completely fine. Not a problem at all. All right. Thank you so much, everyone. Oh, great questions. Once again, thanks to the Shiatsu College and to everyone for taking the time out of your day to do this, and especially to all the people from overseas. Really, really appreciate it.
And thank you, Paul, for your time and for putting the material together and for sharing your wealth of knowledge so freely. We really appreciate that. And always a treasure trove of interesting snippets and pro tips and all sorts of valuable information. So thank you for your time, and thank you for everyone for attending. It's fantastic. We've had a really great response to this.
Thank you.
Just reminding everyone that this is being recorded, and we will share the link with you as soon as we have that available.
Great. Right. Bye, everyone. Have a beautiful day or night, wherever you are.
Enjoy your Sunday or Saturday, everyone.